All right, we are live. I am about to invite in Dr. Tosin Odunsi. We actually just got done with a filming session, which she rocked out a bunch of really cool educational videos. So we're excited to launch that with you, but give me a second. Let me get her invited really quickly. It's been a while since I've done a live, so got to refresh this. This is going to be fun. So we're going to have a little talk with Dr. Tosin Odunsi and talking to all things about what it's like to be an OBGYN, things like that. There she is.
Hi.
Can you hear me all right?
Yep, I can. How are you?
Good. So I was just saying on the live how you and I just got done with our recording and we talked about a bunch of cool stuff. We talked about osteoporosis. We talked about disparities in healthcare as far as being a Black physician.
Yep.
So a lot of cool stuff that we're excited to get out there for sure.
Yeah, great topics.
But yeah, I think that the goal of this live is to kind of talk about something exciting that you've had in the works and that we've been working on together. But let's start off with just this page, Life by Tosin. Kind of what made you even start this page in the first part?
Sure. That's a good question. So a lot of people don't know it started off with two separate pages where I was trying to keep my personal life and my medical life separate. And then I got to the point where I couldn't do that anymore. They were blurring together. So in, I believe, April 2015, that's when Life by Tosin was created. And I've been walking on this journey with my community on how I've been growing through life and encouraging people, motivating them as I navigate different challenges. And it's been 9 years of doing that, and I love it.
Wow. And I mean, we've talked about this a lot together, but you've dealt with a lot of challenges in your life, right? And kind of I don't know, I think it takes a certain level of bravery. Like a lot of those challenges people want to keep private. What made you have the willingness to share that kind of stuff?
That's a good question. So 9 years ago, right after so 9 years ago, a few months after Life by Tosin was created, I went through a major life event. I became a widow at age 28, and that's a major life event for anybody. But being so young, that was the worst possible thing that could ever happen to me, and it definitely changed my how I navigate life, my perspective on life, because I'm constantly faced with the thought of death, or just it's a new thing for me, or became a new thing where I'm considering death in everything that I do. And it's not something that we talk about a lot as physicians, and definitely not in OBGYN, because a lot of our patients are young, healthy. But it did change my perspective on life. And because I went through the worst experience of my life, I was able to navigate failure, rejection, the challenges that people typically have in their later years very early in my life and in my career, and was able to develop this resilience, this grit, this determination that now it's like nobody can actually tell me who I am or what I'm capable of, because I've had to just keep fighting for the past, well, 9 years ago until now. So I'm definitely a fighter.
Oh my gosh, I can't even imagine. I'm not even going to pretend to imagine what that was like for you. But I give you a ton of props, because what I've seen is that there's been a community that's gotten behind that and has shared that hurt with you, and overcoming that and finding the power in yourself to continue to be a successful doctor, and family member and things like that. So props to you.
Thank you. It's
Yeah.
not anything that I'd wish on anybody, but it caused me to grow up fast and realize what's important, what are my core values. And I hope that when people come to my page or to my platform or anywhere that I am, that they leave better than they came, because that's my legacy. That's what I want to leave on this earth. and not leave more pain. There's enough pain in the world. So I want it to be a positive space, but also a safe space for women. That's my demographic, to come, get something, and leave feeling better.
We need more of that for sure, for sure. So, it's been like a personal development page, but now we've made a big decision, or you've made a big decision to combine your personal development where you had lost your husband, but then also with you being a doctor, right?
Right.
And I think that this is going to be a really cool dissection or intersection of these two, of what are you hoping to talk about, and like what do you want to talk about of this transition of combining these together.
Mm-hmm. So like I said, I had the two Instagram pages, the two separate things, and then combine them together. And there's a lot that goes on behind the scenes that patients are unaware of. There are a lot of questions that patients have now that I'm in practice, that I just see a common thread, a pattern of patients are looking for answers. They're looking for somebody to empower them to ask questions and feel seen, feel heard. And that's the big thing that I want to push on all my platforms, that you have a right to get answers to the questions that you have. You have a right to participate in your healthcare. And in addition, let's throw in some lifestyle content, because I'm not just a physician. I have all these passions, and I like to infuse all of that into what I do. But I really want my patients, or whoever's watching, to feel like they can go to their doctor's appointment and ask those questions and get answers.
Yeah. Yeah, I think that people often forget that their doctors are human too, and like, I think it's comforting when you actually see your doctor as a fellow human with you, that's, dealing with their own life and their struggles and just doing whatever they can to make the best decisions for you when you're under their care, right?
Exactly. Exactly. And I also want to dispel myths and misinformation, because now with the advent of social media, there's a lot of misinformation, and I want to help patients navigate that. Like, is that true? Should I be doing that? And it's really hard to navigate that as a layperson. So I want to help patients do that.
And I think that's why we get along so much, because there's nothing that bothers me more than when I see these just crazy claims on social media, because it's a beautiful thing. We have freedom of speech. We can say whatever we want, but with that can be very dangerous, especially when we're talking about people's health.
Right.
And it can be life or death, and people don't realize that. So what is said is really impactful. And so do you want to kind of talk about then what is your plan with this launch?
Sure. So we launched last Wednesday, and the plan is to have weekly videos where there's tidbits of information based on the most commonly searched topics, because I want to plug into what are people looking up. Is it vaginal discharge? Is this discharge okay? Is this normal? That's actually the question. Is this normal? We often navigate life kind of in isolation, which I don't like. And I want us to feel like a community where we don't feel afraid, we don't feel shame to ask certain questions. And I've learned in my practice that a lot of women come to the office and they're surprised when I say, oh, do you have any issues with this, this, and this? They've never been asked that, or they've never felt comfortable enough to approach their doctor with that question. So I want to create a safe space where women can do that. And I'm excited for it.
Yeah, I'm excited for it too. So if people don't know, you now have a website that's live. You have a health education library where you're going to be housing all of these videos. So if you do want to see it, it's tosinoduncymd.com if they want to see this stuff. But it's also going to be on your YouTube channel as well. So
Exactly.
we're trying to get it as far and wide as we can, because the more places it is, the better people can be educated with you and your experience, right?
Right. So on the YouTube channel, it's Life by Tosin, which is the same as all of my handles. But this new venture is called Tosin Odunsi MD. So
Yeah.
yeah.
No, I'm excited. The amount that I've gotten to learn from you so far has been fun. As we made these videos, every time we sit down for like a recording session, it's fun to pick your mind on these topics with it. And it's something that I don't think I realized going into this when I decided to start making this content with physicians, as being like, wow, I'm learning so much just within your area of expertise. And it's pretty cool to see when you kind of dive into your zone of genius and seeing your unique perspective, even compared to another OBGYN, like for example, Dr. Honkin, who I'm working with. Do you think that with this being said, what are some of the biggest challenges that the healthcare system faces currently, and why is this going to be helpful towards that?
Yeah. Well, we've seen recently the discussion has been stirred up by recent events about health insurance and how people are navigating that in terms of ability to pay and access to things that they need. And it's something that I deal with in clinic all the time. I'm on the phone with insurance companies or doing prior authorizations for things that I think will help improve patients' quality of life. So that's one big topic. Another area that I think is going to be huge is this myth busting and what is actually fact. I'm very evidence-based driven, and everything that I look up, that I research, if I don't know an answer to a question, what does the data show? And then what are some things that I may not be able to generalize to different demographics? I'm very passionate about the Black women who I see, because the data has shown that we don't get the same care as other demographics. So you'll see that passion come out in my videos, because I want to be that voice that that population has needed for a very long time.
Yeah, absolutely. And that is a massive thing, especially, I don't know, do you know offhand how many Black physicians there are, or like percentage wise, especially being female and Black?
Yeah, so it's about 5% of physicians in the US are Black, and then almost 3% are Black women.
Wow, wow. So it's by far the minority, and that's obviously impacts the care, which we actually talked about in the videos today about how they're Black women or Black people in general are misrepresented in clinical trials, and then that can lead to so many downstream effects, which
Right.
I learned from today, which was interesting to learn. Um, just while we're on here, because it is a hot topic of what happened with the United CEO, what do you think potentially could cause someone to take action that intensely?
Mm. It's interesting that you asked that, because I've kind of been listening to different sources of why would this happen, and I'm paying attention to the comments under the post, and I think there's a need for an overhaul in the healthcare system, because patients aren't feeling like they're getting the care that they need. Maybe they're getting denied. Now, I'm not saying that's the reason for what happened. I'm just saying it's spurring conversations about potential theories of why someone would go after such someone in such a high position. So it's going to force insurance companies to take a look at their practices and listen to patients, listen to physicians, because we're the ones who have to deal with this on our day-to-day basis. So I'm curious to see some of the changes that might come from this. And I think it's time for patients to be listened to.
Yeah, absolutely. I can't get behind the action that was done. I would never
Absolutely.
for doing that. But it is raising awareness of something that you and I see every day, and that is the challenges of patients getting the care that they need, but being denied by the insurance company.
Absolutely. Absolutely.
And
And then we compound that with, so medical debt is a huge issue. We compound that with educational debt, so the debt with student loans. That is a big stressor on an individual, on a family. So it'll definitely increase the conversation around those topics.
yeah, I've had times where I'm seeing patients in hospital, and all they can focus on is how they're going to pay this bill.
Exactly.
If they just
Exactly.
see all these professionals coming in, they think, wow, my bill's getting higher and higher.
Mhm.
And you're like, this is not where your head should be right now while you're trying to.
Exactly. Exactly.
I think what people need to understand is it's a very complex issue. Like it's not as simple as, oh, the insurance company should just pay for everything,
Hmm.
because, that would lead to its own problems as well. But that's where having conversations like this and getting into the public health policy and things like that to kind of figure out what is the best solution.
Right. And I don't
Yeah.
condone the action. It's the discussion that I'm paying attention to of what people are saying.
Sure. Yeah, I agree 100%. Um, well, cool. So is there anything, if someone were to come in to see your page right now, what are the people that would get the most value out of it?
Sure. The people that would get the most value out of coming to my platform, coming to my page, would probably be women between the age of 20 to actually OBGYN spans from all the way to childhood to end of life. So if you are in that category, my page is for you. It's also for people who tend to do Google searches on topics versus talking to their physician about things, which there's nothing wrong with that, but we are taking a look at that data, and that's how we're formulating the videos. So we want to answer those most searched Google topics and give you those answers so that you don't have to do that type of research. And I know from personal experience, sometimes it's difficult to navigate that. Like, what is actually true? What's facts? What's going to work? Has this been studied? Will this work in me? So I want to do that due diligence for you. And that's what you can expect from my page. And then the last person that this platform would be good for would be the person who wants to see a page that grows with them, that listens to them, and is not just about me. This is not about me at all. I have the scrubs on, I have the degree, but this is about you, and I want you to feel heard and seen. So if you do have a topic or a comment, we're going to read through those, we're going to see them, and that's going to change the trajectory of future videos. So I would encourage you to leave comments, leave feedback, things like that, as long as it's positive and constructive. We don't need to be bullies online, but I do take those things into consideration and very seriously. So definitely start this engagement, and I want it to be a safe space for you to ask your questions.
It's not so common to see a busy physician that actually is dedicated and takes the time to read the comments and things like that. But you're doing it for a reason, because you're trying to make a positive influence in this world. And the only way we're going to do that is if we listen, right?
Absolutely.
Yeah. So I'm super excited for it. We've already got good stuff coming out. So like, I think that this is only the beginning. And hopefully we can hop on lives like this intermittently and start picking each other's minds, start talking about tough topics, and hear what people have to say.
For sure. Thank you
That
so
sounds
much.
good.
This was fun.
Of course, absolutely, for sure. So people, make sure go follow Life by Tosin if you want to see her website. What is it? It's TosinOdunsiMD.com. And this is only the beginning. So we're excited for it.
Yes.
All right,
Awesome.
thank you. I'll
Take
see you.
care.
Bye.
Bye.